The Wonders of Medicine, Unit 5, Part 2, Treating Specific Diseases and Conditions, Helicobacter pylori and New Drugs for Peptic Ulcers. It was long thought that peptic ulcers were ulcers. So, so, also, it was long thought that peptic ulcers were caused by stress or spicy foods. This common belief was eventually refuted in 1983 when Dr. Barry J. Marshall and Dr. J. Robin Warren made a startling breakthrough in 2005. They were awarded the Nobel Prize in Physiology or Medicine for their discovery of the bacterium Helicobacter pylori and its role in gastritis and peptic ulcer disease. Although this bacterium was known to scientists as early as 1875, it was not initially associated with the peptic ulcers because it was believed that no organisms could live in the acidic environment of the stomach. The Helicobacter pylori, H. pylori bacterium, however, is one of the new. It's one of the few organisms that can survive in such an environment thanks to the ammonia it secretes. The discovery that peptic ulcers are caused by the colonization of these organisms in the stomach suggested that peptic ulcers could be cured simply by getting rid of the bacteria. When the ulcer is found, the doctor performs a biopsy to determine whether the ulcer is cancerous or caused by the presence of H. pylori bacteria. If tests confirm that the ulcer is H. pylori related, it is treated with drugs. Two kinds of antibiotics that kills the bacteria. Other drugs used to treat peptic ulcers include H2 blockers, proton pump inhibitors, and antacids. These drugs reduce or neutralize the production of stomach acid, thereby promoting healing, whatever the cause may be. H2 blockers are the pillar of the ulcer treatment. When histamine binds with H2 receptors, gastric acid secretion is stimulated. H2 blockers prevent this binding and hence prevent acid secretion. Proton pump inhibitors are the strongest of the drugs to suppress acid production by halting the mechanisms that pumps the acid into the stomach. Antacids raise the pH level to reduce acid damage, and sclerosphate is used to protect the stomach lining. Formerly, patients with peptic ulcers underwent surgical procedures to remove the ulcers, but the discovery of the bacterium Helicobacter pylori and its role in gastritis and peptic ulcer disease, coupled with the development of new drugs over the past 20 years, has allowed 90% of patients to be cured of H. pylori-related peptic ulcers without any surgical procedures. These drugs are always used in combination because when used alone, they neither eradicate H. pylori nor cure the ulcers, which may lead to the recurrence of the disease. Motion Warren's discovery, along with these revolutionary new drugs, is making life far less painful for thousands of ulcer sufferers.